Hello there. Our topic for today is motor neuron disease, amyotrophic lateral sclerosis or Lou Gehrig's disease, right? So in this part, this is the part 1 for motor neuron disease, where we will be discussing the definition, causes and the classification for motor neuron disease. Motor neuron disease includes a heterogeneous spectrum of inherited. Heterogeneous because it has a variety of clinical presentation. Sporadic clinical disorders because it is episodic of upper motor neuron, lower motor neurons or combination of both. Amyotrophic lateral sclerosis is an inherited disease where there is degeneration and loss of motor neurons in the spinal cord, brainstem and brain, resulting into a variety of upper motor neuron and lower motor neuron clinical signs and symptoms. Types of motor neuron disease include: first, amyotrophic lateral sclerosis, where there is degeneration of corticospinal tracts, neurons in the motor cortex, brainstem, anterior horn cells of the spinal cord. Primary lateral sclerosis, there is degeneration of corticospinal tracts, only the corticospinal tracts, therefore only upper motor neuron type of lesion. Progressive bulbar sclerosis, there is degeneration of motor neurons of cranial nerves 5, 7, 9, 10, 12. Always remember, it is motor neuron disease, so there will be only motor clinical features. And whenever you come across a term which is bulbar, bulbar is always related to cranial nerves. Progressive muscular atrophy, where there is loss or chromatolysis of motor neurons of spinal cord and brainstem. Frontal dementia, frontal atrophy in the precentral gyrus. Pseudobulbar palsy, where there is a degeneration or affection of corticobulbar tracts. Coming on to the etiology. Etiology of most of the cases is unknown. However, there is a hypothesis for a variety of reasons, but it is possible that the mechanism responsible for neurodegeneration is as a result of a combination of variety of causes. The first is superoxide dimutase. This superoxide dimutase are a group of enzymes, right? They eliminate the oxygen free radicals. This elimination of the oxygen free radicals leads to neurodegeneration, right? The presence of superoxide dimutase is as a result of mutation of primary gene defect, which leads to neurodegeneration. The second cause is glutamate. Glutamate is an excitatory neurotransmitter that has been implicated in neurodegeneration. Excess glutamate triggers a cascade of events leading to cell death. Clumping of neurofilament protein into spheroid in the cell bodies and proximal to axon is one of the histopathological characteristics of ALS. Clumping of neurofilament because due to cell death there occurs clumping of this neurofilament protein. This is known as tau protein. Okay, due to the cell death there occurs this clumping of the neurofilament protein. Also, it has been found that autoimmune reaction, several studies have found serum toxic factors to anterior horn motor neurons in individuals with amyotrophic lateral sclerosis has been reported. Lack of neurotrophic factors also contribute to development of ALS. Neurotrophic factors are nothing but the factors responsible for the nerve cell sustenance or nerve cell growth. It was found that there was a lack of this neurotrophic factor which could contribute to development of ALS, right? So these are a variety of causes responsible for ALS, but still there is no single cause yet found for the cause of the amyotrophic lateral sclerosis. See, there will be a combination of clinical features depending on the area of affection, depending on the area of degeneration, right? Thank you.